In this teaching module, I am going to be talking about reprocessing of fiber-optic bronchoscopes. Flexible endoscopy heralded a new era in diagnostic and therapeutic pulmonary medicine with the improvements in technology, the sophistication and the capabilities of these electromechanical devices have increased tremendously. These expensive instruments are not disposable, so they have to be reused. These are complex instruments with external surfaces and internal channels which are utilized to take suction, biopsies, and there are certain channels which change the position of the scope, which is called elevator channels. So these complex instruments, they need to be cleaned properly because they have to be reused. Now let us see how much is the incidence of infection after fiber-optic bronchoscopy. It has been found to be very low. Why? Because maybe due to uncommon occurrence, or infections may be under-recognized as they are easily masked by the primary signs and symptoms for which bronchoscopy is being performed. It has been said that the incidence of pneumonia is less than 1%, but bronchoscopy is identified as a sure shot independent risk factor for healthcare associated pneumonias. Infections after bronchoscopies are most commonly due to mechanical or structural defects in the device that lead to inadequate reprocessing. If there is a tear in the channel or leak in the channel, that tends to accumulate lot of bacteria and which can be given to the next patient. So it is very important to